Today I'm doing my speech on hypertension. How many people have ever checked their blood pressure, like recently, in the past few months? So only a few of us. Do you even remember what it was?
Well, no, I can just tell you it wasn't good.
Oh.
It was high.
Well, many people do not think blood pressure is that big of a deal, especially since we are all younger. However, we need to pay closer attention to this. 67 million American adults have high blood pressure. That's 1 in every 3 adults, which is very high. And only 40% of these adults that have hypertension have it under control. And this can be life-threatening. Today I'll give you some information about hypertension, and by the end of my speech you'll know about this condition and how you can recognize if you're within the 33% of the adults that suffer from this. You'll also be given valuable information to help you with the precautions that you should take to avoid hypertension. The 3 points I'll be going over is hypertension, what it is, the symptoms and causes, and prevention and management. Hypertension is abnormally high blood pressure. The normal blood pressure is 120/80. The higher number is the systolic, and the bottom number is the diastolic. When you're considered to be in the hypertension range, it's usually 140/90 or above. At like a resting pace, your blood pressure rises when you're doing physical activities and nervous or stressed or anything else like that. When hypertension occurs, the pressure within the blood vessels is too high, and as you can see in the picture, the heart will expand, which can cause heart attacks, and this picture is of the blood vessels. It thickens, so the blood can't move as quickly, and it can cause clots, which cause strokes. It can damage your arteries and organs because of lack of oxygen, and it includes the heart, brain, kidneys, and eyes, which are pretty important. So you need to make sure. And this information is from the Mayo Foundation of Medical Education Research. The symptoms and causes are typically a symptomless condition, which is hard to diagnose because you normally feel fine, and you can sometimes feel headaches or dizzy spells or nosebleeds, but that's usually when it's severe hypertension, like 180/100 or 110, which is then considered a hypertensive crisis and should be hospitalized. The causes are age, stress, certain medications, illegal drugs, and alcohol abuse contribute to it. Sometimes high blood pressure is just genetic or idiomatic. They aren't too sure why. And other medical problems such as chronic kidney disease and thyroid disease and sleep apnea can contribute to these as well. Now that you know the symptoms and causes, I'll move on to tell you how to prevent and manage it. This information came from the National Heart, Lung, and Blood Institute. If you live a healthy lifestyle, maintaining a healthy weight, eating a low-sodium diet, exercising, limiting alcohol, and no smoking, you can help prevent it. However, again, sometimes it's just inevitable. There are medications, though, such as beta blockers and diuretics that help lower blood pressure. Your doctor will put you on whichever one fits you best. And you should monitor your blood pressure regularly, whether you have high blood pressure or not, because you can develop it, especially as you age or just out of the blue. After hearing about the prevention and management of hypertension, I'll move on to my summary. It can be life-threatening if not controlled. It can cause vision loss, brain stroke, heart attacks, kidney failure, and blood vessel damage. There are usually no signs of hypertension, so you really need to check your blood pressure regularly and know which range you should be in. And by leading a healthy lifestyle, you can help prevent it and manage it. So the next time you're at Publix, just take the extra 2 minutes to go to the little machine. It's free. And check your blood pressure. It only takes about 2 minutes. And you can see if you fall within the 33% of Americans that have high blood pressure. Thank you.